It didn't come up. So I'm afraid I'm going to do that one more time. Can I introduce you one more time? It was really good the first time. Thank you to our audience for your patience with me. This is Beth Foss, take two. We are holding our webinar tonight because we're meeting with almost Dr. Sena Gocuk, who's joining us tonight from Melbourne, Australia, where she's conducting research and work on carriers. And so tonight, as we just discussed, we're going to be talking about everything to do, or many things to do, with women in choroideremia, being carriers, maybe some of the psychosocial or the emotional aspects, but as well as type of the physical kinds of things that maybe we have with our eyes and our vision as well. Sena has been really a great part of the CRF for a little while. And so she's been conducting research with IRD patients, including choroideremia. So we're just excited to have her here and excited to have you all here tonight. We're going to thank our sponsor, 4DMT, again, for helping co-fund this. And as well as please use the chat feature or the question and answers, and I will be sure to monitor the chat, pose the questions, and we'll go ahead and get started. I think that's it. Thanks for your patience to our lovely audience that's with us tonight. So tell us a little bit about yourself, maybe before we get started, and then I'll turn off my camera and you can share your screen and we'll take it away.
No problem at all. Thank you for the introduction, Beth. So I've actually got a couple of slides introducing myself as well. So I might just get straight into sharing the slides that I have. There we go. And I'm hoping you can see that over there. Perfect. Yep. So thank you all for attending, and thank you to the CRF for giving me this opportunity to speak about our project and what we're doing in Melbourne. Alrighty, so like Beth said, I'm from Melbourne in Australia. I'm a clinician-researcher, so I've got an optometry background, and I do some teaching of the Doctor of Optometry course at the University of Melbourne. And in 2021, I started my PhD candidature, and I've just got some photos here. So this one is of our lovely city in Melbourne, and this is one of the iconic buildings at the University of Melbourne. So my PhD is supervised by Dr. Tom Edwards and Associate Professor Lauren Ayton, and they're both located in Melbourne, so at the University of Melbourne and the Centre for Eye Research Australia. And then I've got my UK supervisor, which some of you may be familiar with, Associate Professor Jaslene Jolly as well, and she's at the Anglia Ruskin University in Cambridge. And in Melbourne, I'm very lucky to be a part of the retinal gene therapy unit. So I work with a group of amazing researchers, and our unit heads are my supervisors, so Associate Professor Lauren Ayton and Dr. Tom Edwards as well. So our unit is kind of split into two. We've got our clinical trials team, and some of the trials that we have is gene therapy for macular degeneration, and a couple of trials for using oral supplements for various inherited retinal diseases. And we've also got our natural history team, and that's where our study called Venture comes in. So I'll speak a little bit about Venture now. So it stands for the Victorian Evolution of Inherited Retinal Diseases Natural History Register. And this is a registry where we can look at, or we can capture, clinical and genetic data from people with inherited retinal disease in Australia. And it allows us to have all the everyone that we know with an inherited retinal disease in the one place. So once there is a clinical trial or other for emerging therapies, we can identify patients who are suitable. And currently we have more than 280 patients registered, and it's growing every day. We're getting more and more referrals, and the team is doing an amazing job at seeing these patients, ordering genetic testing. And that's where the female carrier sub-study comes in. So for my PhD, I'm looking at multiple aspects of the clinical characteristics of female carriers of X-linked inherited retinal diseases. And that includes both choroideremia and X-linked retinitis pigmentosa. Now, before I get into carriers, I just have a couple of slides on IRDs in general. So as we know, they're progressive retinal degenerations due to genetic mutations that lead to or potentially lead to vision loss. And it's estimated to affect 1 in 2,000 individuals worldwide. And of interest to us, choroideremia affects approximately 1 in 50,000. And on the right here, I've got one of the retinal photo for one of the choroideremia participants in Venture. And you can clearly see the changes that are occurring there. So males affected with choroideremia present with night blindness and peripheral vision loss, followed by central vision loss at the later stages of the condition. And it's been found that males with a milder presentation initially tend to remain on a mild trajectory of disease. So their rate of progression or their onset of disease, if it's a bit slow, it remains slow. And then, so a study tried to look at some correlations between the genetic mutation and the presentation of disease, but there were no clear correlations found. So what they hypothesized was that there's potentially more genetic modifiers and environmental factors which influence the onset of disease and rate of progression, as I said. Now, moving on to female carriers of choroideremia. So previously, there was a common misconception that female carriers are asymptomatic, so they're not affected by having a single copy of the disease-causing mutation. And generally, although they usually have a milder disease and vision loss compared to males, we now know that it's a spectrum of retinal severities that we see. And in 2015, an article was published, and 2 of my supervisors, so Tom and Jasleen, were involved in this study. And what they did was they invited choroideremia carriers, looked at their retina, and they were able to come up with a 4-tier classification approach. So just looking at these images here, so in panel A, we have a near normal retina, and that is the fine phenotype, or the fine, what we refer to as fine severity or mild. And panel B, you can see these black little spots or patches in the retina, and that's what we refer to as the coarse phenotype, followed by having little areas of atrophy or areas where the retina has died off, and that's known as geographic phenotype, followed by panel B, which is what we call male pattern, because there's severe retinal degeneration, and this is typically what we see in males with choroideremia. Now, one of the mechanisms that we believe is responsible for this variation that we see in female carriers is X chromosome inactivation. And just to kind of talk you through it, so we know males have a single X chromosome and females have 2 X chromosomes. Female carriers, as I said, they've got a single copy of the disease-causing gene and 1 wild type, or what we refer to as maybe the normal gene. And during early embryonic development, a single X chromosome is inactivated at random, and just to make up for that dosage compensation, so having that additional X chromosome that males do not have. Now, the tissue, so of interest to us, is the retina, chooses which cell to activate and which to inactivate. And it's the overall percentage of mutated versus normal gene we believe determines the severity that we see in female carriers. However, we need to answer this I guess, definitively. So does X chromosome inactivation, or that percentage that we see in the tissue between expression of the normal versus the wild type gene, whether this explains that severity we see? And although a biopsy of the retina will allow us to study each individual cell for obvious reasons, that's not really an option for us. And so I believe that it's the perfect time to learn more about carriers. So if we consider the current clinical trial landscape, on clinicaltrials.gov, there are currently 10 registered gene therapy clinical trials for choroideremia. And unfortunately, in the inclusion criteria, there are no female carriers included. However, we do know that they do present, or they may present, with the male pattern degeneration. So there are some women who may potentially benefit from clinical trials. So the overall question that I'd like to answer through either my PhD or our studies in general is, should female carriers be considered for emerging treatment options? Which brings me to our female carrier sub-study. So as mentioned, I'm looking at the retinal characteristics and other clinical characteristics as well of female carriers of choroideremia and X-linked retinitis pigmentosa. And similar to Venture, we're collecting clinical and genetic data for these women, and we currently have more than 80 female carriers registered. And this is through multiple sites. So the University of Melbourne, Centre for Eye Research Australia, Anglia Ruskin University in Cambridge, Associate Professor Fred Chen, who's at the Lions Eye Institute in Perth, Australia. And the beautiful photo here is one of my favourite photos of Perth. And Professor Robert McLaren as well at the University of Oxford and Oxford Eye Hospital. And that's, again, one of my favourite photos of Oxford there. So we're looking at multiple aspects, as I mentioned, and one of the areas is pretty much looking at the retinal characteristics, as I mentioned. So building on that article that was published in 2015 and looking for more correlations between the type of genetic mutation, where it is, how long the mutation is, and whether that correlates to the retinal severity that we see in the female carrier retina. We're also interested in looking at the retinal vascular reactivity. So just looking at the blood vessels, there is kind of mixed information about whether blood vessels in the retina are affected by having the disease-causing gene. But what we'd like to know is whether the dynamic changes in the blood vessels are affected. So in environments of low oxygen levels or high oxygen demand, whether the blood vessels can constrict and dilate to keep up with this demand. We're interested in looking at the visual symptoms affecting everyday tasks. We're interested in looking more into this X inactivation and whether that percentage it correlates with the retinal severity. And as I said, we can't directly look at the retina at this stage. So we're using other tissues such as blood, saliva, and cheek cells to correlate with the retinal severity that we see in the retina. We will also be performing the first longitudinal study of choroideremia carriers. So early this year, I traveled to the UK and I re-invited all the carriers from the initial study that was published in 2015 for a follow-up, and we're currently at the stage of analysing the images to actually answer whether female carriers progress or whether their severity remains the same and stable throughout the years. So that's approximately 10-year data for us, and we're really excited about this study as well. Now, the last two studies there, we received 2 generous grants from the CRF to support them. And so we're very grateful, and hopefully we can share the findings of these with you in the future. And another aspect we're interested in is the perspectives of female carriers. So for the remainder of my talk, I'll be just sharing our findings with that study. So it was a global survey that we distributed just to look at perspectives regarding genetic testing, genetic counselling, and gene therapy. Are there any questions at this stage? Maybe I should just...
Nope, not yet.
Cool. Okay, I'll keep going. Perfect. Okay, so to give you a little bit of background, so perspectives of female carriers were investigated, but for other X-linked conditions, so not for the eyes. And this earlier study, which was published in 2008, looking at female carriers of a bleeding disorder known as hemophilia, found that the carriers identified with shock and grief, concern about having children, feeling blamed by their partner for passing down their disease-causing gene, and a prolonged sense of guilt. A relatively newer study, which was published in 2021, also found, looking at multiple X-linked conditions, found out that a little more than half of the carriers only found out that they were a carrier after they had an affected child, even though majority of the respondents, so 83%, felt that they already had relevant symptoms to their X-linked condition. However, in this study, only a single choroideremia carrier was included, so no X-linked retinitis pigmentosa. So there was definitely a need to investigate perspectives of female carriers of X-linked inherited retinal diseases. So we wanted to understand the impact of potentially passing a disease-causing gene to future generations on carriers and investigate their experiences relating to genetic testing, their emotions relating to having an affected child, and just their overall knowledge regarding genetic testing and gene therapy as well. And like I said, it was an online survey which we distributed globally, and it would comprise of 3 sections. So the first section was just a little bit about demographics, so we know which condition they've got when they were diagnosed, genetic testing experiences, and the second section was more relating to their emotions, and the third was about their knowledge relating to, like I said, genetic testing, genetic counselling, and gene therapy. So we received 278 responses, and 70% of those were choroideremia carriers. And in this image on the right, the map shows the countries that we received responses from, and the, I guess, how many from each country as well. So half of the responses were from the US, and then we had the UK and Australia at 20% of the responses. And then we had some other countries, including Canada, some European countries, some countries in Africa, Israel, and New Zealand as well. And generally, carriers were diagnosed around the 28 years of age, and 56% had genetic testing to confirm their diagnosis, whereas 37% were diagnosed based on having a male relative, so just knowing who in their family is affected. And only 38% had seen a genetic counsellor to potentially discuss their diagnosis or family planning. So section 1, so relating to their genetic testing experiences. So the reason for seeing a genetic counsellor for our respondents was the majority was to understand the condition, understand their risk of having a child with an inherited retinal disease, and a little did want to know about treatment options such as gene therapy. And this was matched generally to the help they did receive from their genetic counsellor. However, when we compare that to help received by their clinician, so their clinician could be general practitioner, it could be an optometrist, an ophthalmologist, we found that they were really good at explaining the condition, and a little less than genetic counselling, understanding risk of having a child with an inherited retinal disease and treatment options. And this could potentially be due to the fact that female carriers are not included in the inclusion criteria of current clinical trials. And so potentially there's nothing to explain. However, even just giving that kind of information to keep an eye out, I believe is useful in providing that support to our carriers. In particular, if I have a look at more around that support and counselling, so family planning, mapping out the risk of having a child with the condition, and options to potentially avoid passing that gene down through IVF, for example. That was not really a reason for seeing a genetic counsellor, which kind of matched the help they received from their genetic counsellor. But if we compare it to the help from clinicians, it's a lot lower. Particularly around emotions, for me, is very important, as carriers may request that kind of support from their clinician, but they report that they're not receiving it. So moving on to our second section. So in this section, we provided some statements, and our respondents had to indicate their level of agreement. So blue indicates disagreement, green is being neutral, and yellow is agreement in this bar. And I'll go through some of the statements. So for the statement, I felt anxious about my child's vision. 89% of our carriers indicated agreement with this statement. For the statement, I felt guilty towards my child. 71% of our respondents agreed with this statement as well. I felt concerned for my child. So this one's 91% of our respondents agreed that there was that concern for their child. And interestingly, 52% of our respondents also agreed that they felt anxious about their own vision. So yes, there was that concern about their child's vision and that guilt, but they were also anxious about their vision and potentially not knowing what to expect currently or in the future. And the final section, which is relating to knowledge. So some of the questions in this section we obtained from a larger questionnaire, so called the Attitudes to Gene Therapy for the Eye. And this is an Australian survey, which was asking people with inherited retinal diseases about their knowledge of gene therapy and potentially their uptake of gene therapy if it was offered or available to them. And this was a study run by Associate Professor Heather Mack in Australia. And what we found is when we compared the responses from the carriers in our study to the people with inherited retinal diseases, carriers had comparable or better knowledge compared to people with inherited retinal disease for genetic testing and gene therapy. And in particular for areas such as when genetic testing is required, privacy around receiving the results and the samples that were sent, advantages of genetic counselling, and the aim and processes of gene therapy, so what's involved in those processes. So to give you a few examples, so for the statement, having gene therapy means a person will not pass on their eye condition to future children. People with inherited retinal disease, so 62% of them agreed with this statement. However, correctly so, female carriers were able to identify that this was an incorrect statement as they disagreed with it. And again, so they were asked about their level of agreement with the following statement: I will lose my privacy and my data will be in the public domain. People with inherited retinal disease, so 70% agreed with this statement, compared to 74 of the carriers in our study, which were able to correctly disagree with this statement. And so of interest to us as well, again, is for the statement gene therapy should be available for carriers of an inherited retinal disease. It was quite interesting to see that 78% of carriers agreed with this statement. So this potentially indicates that we should be considering female carriers for treatment, and potentially they are willing to take on these clinical trials or these treatments if it was offered or available to them. So we're really interested in the results we obtained of their knowledge. So then we performed a sub-analysis because we wanted to know, does their knowledge change if respondents had genetic testing, if they had genetic counselling, or they had given birth to a child? So I'll share these results with you as well. So if respondents had genetic testing or genetic counselling, this meant that their knowledge of genetic testing and genetic counselling increased. So, I mean, that makes sense. So if they've had if they've had access to these services, they know what to expect. And so their knowledge of these services was increased compared to respondents who did not have access to these. And if respondents had given birth to a child, this again improves their knowledge of genetic testing. So potentially that could be due to needing genetic testing either to confirm their child's diagnosis or be involved in the process of receiving genetic testing, again, to confirm their child's diagnosis as well. But of interest, it was the only factor which improved gene therapy knowledge. And so for us, that we believe that this proves the power of the maternal instinct and wanting to know more about treatment options to help their child. So that's quite powerful in just knowing a little bit more about mothers and carriers in general. So we believe that we should be all working together to remove those feelings of guilt. So nobody should be feeling guilty about passing down the disease-causing gene. This is a biological chance that this mutation will keep being passed down in generations. And so we should really work together to remove those feelings. We advocate for improved clinical care by healthcare professionals. So working together with optometrists, ophthalmologists, genetic counsellors, and counsellors in general to provide that much needed support to help carriers understand about their condition, about the gene, what to expect in the future, those feelings about their child, and which will allow informed decision making and potentially taking on therapeutic treatment if it becomes available to them. We also believe that carriers should have more genetic testing and genetic counselling. If you remember, I said that 56% had genetic testing in our group of carriers, and only, I believe it was 36% had genetic counselling. So we believe these numbers should be a lot higher, because there is obviously that need for support there and just knowing a little bit more about the condition. I'm hoping that, once I'm done with my PhD, I will be able to answer whether female carriers should be eligible for therapeutic options, and in particular identify which carriers. So not so much the ones with the milder phenotype, but definitely the ones with the more severe or male pattern degeneration. And as well as predict the natural progression of condition over time. So we know a little bit about how males progress over time. And so just knowing, like I said, whether female carriers also progress or they remain stable. So that's something that we'd like to know more about. So I'd like to take this opportunity first to actually thank my supervisors. So I'm very grateful for the many opportunities they have provided me with during the couple of years of my PhD, and are continuing to do so, as well as all our collaborators, support groups and associations, of course the CRF as well, as well as distributing survey, but also the grants that I have received. And all this support has really helped me during my PhD and answering these questions that I have about female carriers. But most importantly, I'd like to thank all the female carriers who have participated in our study, whether it's through attending a study visit or completing our survey. So thank you very much.
That was wonderful.
Thank you. I'll just stop sharing my screen.
I like that. No, that's beautiful. I like that too. Well, let's see if we get any questions. I'm going to watch right here and see if any come in. That was very interesting. And it's great to see those statistics come in. Because you're a clinician too, when you see patients, what are the carriers specifically? What are some of the things that you talk with the carriers about the most? I mean, data is wonderful, but in your interaction with patients, what typically do you find most striking?
I feel like it really depends on their backgrounds pretty much. So if they've been referred to me because their father was affected, they really want to know about the condition, how they will be affected, and what to expect in the future. If they've been referred to me because their son's in venture, or they saw their ophthalmologist for their child, then they really want to know more about their kid. So they really want to know, how does it affect their child? And, just a little bit more, not so much about them, but about what to expect for their child, what treatment options are available for them, and when that's going to be offered, pretty much.
Right. That's true. Hey, we have a couple questions. So let me ask you, this is from an anonymous attendee. Is it known if different mutations cause faster progression in females? And if so, which ones? Good question.
That is a very good question, and that's a question that we'd like to answer as well. So from the more than 80 patients that we do have registered, we really do want to look at, because we do have the clinical data and the genetic data for these women, and we really want to look into that analysis as well. It's just a lot of images to process, but we're doing all we can to answer that very question.
Is there a timeline for that?
I guess when I submit my thesis, which I'm hoping is early next year, I'm going to have this data out. But similar to the study I mentioned, looking at males with choroideremia, so they didn't really find a clear correlation between the genetic mutation and the clinical presentation. And so there might be other factors, so genetic modifiers, environmental factors, and potentially that might be very similar for female carriers as well. So we might not be able to have a clear correlation saying that this mutation causes this phenotype, but at least we will be able to report on that as well.
Sure. When you surveyed your returning CHM females, did they report any subjective loss of vision over time, or are you just looking at the imaging?
No, so we are doing a lot of, so there's the Michigan Retinal Degeneration Questionnaire, which is targeted at people with an inherited retinal disease. So we are getting all our carriers who we do have clinical data for to complete that survey as well. And so there's 7 domains that questionnaire looks at, such as color and contrast, night sensitivity, light sensitivity, all those different aspects. So we are very interested in that patient-reported outcomes as well, so what they're experiencing in their daily life. And again, we will be reporting on that quite soon.
Excellent. This person had 3 questions. Good, keep them coming. Are there any other lifestyle or genetic factors that might contribute to faster progression? Excuse me.
Yeah, so again, that's a very hard question to answer, because to be able to make a clear correlation, we have to analyze each of those individual aspects. So if we're saying it's not the genetic mutation, and potentially we're saying that it's not X inactivation skewing, so that random chance occurrence during early embryonic stages, then we need to look at all these other factors. So if we, for example, predict that smoking increases progression, then we need to perform a study that's specifically looking at carriers who are smoking versus not. So it's very hard to answer that question, but it's definitely something that can potentially be done just by analyzing some of the I guess the demographics questions, or the answers to some of the questions we are asking. So we are capturing smoking status and all that in our carriers, but it'll have to be a separate analysis to be able to answer that.
Mm-hmm. Here we go. Here's somebody that I have been involved with the CRF for years, but have never been contacted to participate in a study of female carriers, and I would like to be included. So how do we get included in this?
Oh, that's beautiful. It's great to hear that more carriers want to be involved in research. And I think so the CRF definitely did help us with distributing the survey. So I'm sorry if you didn't get alerted for that. Definitely, I'm more than happy to contact you and just let you know what is available there, and what's I guess in your country. It'll probably be a little difficult to travel to Australia to attend one of the researchers. Yeah, I mean, I would love that. But yeah, definitely more than happy to have a chat. And yeah,
you can definitely go to our website, or you can email me, email our executive director, and we can make sure that we get those surveys and those contacts, certainly your contact information, out to them. Okay, let me just keep checking here. Let me check the chat. Just questions and answers. Good. I don't think so. Let's just give it another few minutes. Oh, here comes another one. Laura. Hi, Laura. Yes, I would like to know about any testing for females having issues. Okay. So you know what we're going to do? We'll put something out. Maybe specifically, we'll put something out on our website. Maybe what we need to do too is we have 2, one international and one based in the US, mom support chat groups. They typically get together monthly. We took the summer off here in the US, but you're going to be hopefully joining us later on this fall and talking more about female carrier issues. So we'll make sure we get more information out about these testing and protocol standards. Hey, here comes another one. I have so many screens open. I just need to go to the chat. There it is. Can you see it?
Yeah, I think they anonymous attendee again. Also, is this PowerPoint shareable? I would like to show this to my family. I mean, I'm more than happy to share the slides.
Awesome. Good. Thank you. Here we go. All right. We got Did your survey assess the value of participating groups?
In support groups, yeah. So unfortunately not, but that is a very interesting area as well. So potentially I would like to know actually whether participating in support groups, knowing of other carriers, whether that kind of helps with that guilt, maybe, sharing sharing the knowledge and sharing maybe those feelings may reduce them. I have no idea. But yeah, an interesting area that we can potentially look at asking in the future.
I think that's one of the values of having the CRF, having support groups, is that you have women and mothers, especially coming in at different stages with, women who have adult children with choroideremia and new ones coming in. Sometimes just that value added conversation and assurance and reassurance. And I think the more information you always have, then it always better equips you to how to handle those emotional turmoils when you have science, when you have data, when you have real good information, then you feel like you can control it, if that's a right word, maybe not. But you're able to be more involved, get involved in the organizations so that you keep a pulse on things. That does seem to help. But that's what a very valuable thing to have, I think, is those support groups for sure. Yeah,
definitely.
I think that's, here we go. Are you asking if female carriers have a greater risk of miscarriage? Sorry to ask a sensitive question. No, that's great that you're asking these. That's
good. No problem at all. No. I mean, there's no evidence to suggest that this would be a thing, even if it was kind of found in other X-linked conditions. That would have been something. It's not something that I've read in the literature, but again, I don't capture this data, so I'm not really sure about miscarriage, to be honest.
One of the things, and this is a little sticky, or you have to be careful about the conversation, but something that we always tend to talk about during our conferences, certainly we've touched upon it in the support groups, is either IVF or sex selection. Is it possible to be able to get pregnant with a girl, right? If you're a carrier, and that would be something that would also be measurable, perhaps down the road, because that's a very real conversation that a lot of people have had, which is hard.
Definitely.
That's a hard. It's just.
It's a very hard, it's a very sensitive topic, especially for carriers. So I've got a couple of carriers who I saw in clinic, and they've gone down the IVF pathway, and it's not always about selecting the sex, because as I kind of mentioned, you may end up with a female carrier with severe degeneration. So sometimes it's not so much about choosing the sex of the child, but so much maybe avoiding passing that gene down altogether. So definitely IVF with pre-implantation genetic testing does offer that. So that is something that genetic counselors or clinical geneticists may provide more information on.
Mm-hmm. Those are hard topics.
Exactly. Yeah, it really is. Yeah.
Let's just make sure. Okay, we're kind of winding down.
Yeah. In the chat, there is a lady, I am also in Australia, would like to be contacted for surveys and testings. So thank you very much for your interest. And if you'd like to, pass your email to maybe Beth, and she can pass it on to me, and I'll get in contact with you. Thank you. Sure.
So just for those people that want it, certainly you could go to our website always, but I'm at Beth, BETHFOSS, at curechm.org. Okay. This has been wonderful. This is a great topic. Thank you so much.
No worries. Thank you so much for the opportunity. And more than happy to be contacted if anyone else comes up with any questions or, so.
Here we have some more people saying thank you.
No problem.
All right, everybody, thank you for joining us, and thank you for your patience again for the restart at the beginning, but we look forward to seeing you. We have a lot of activity coming up with webinars in the next couple of weeks, so check out the website, watch your email, as you'll be getting more information about those upcoming webinars. Enjoy. Hey, so tell us a little bit about Australia. Can I just ask you, what's the weather like right now? Come on.
So right now it's actually it's getting quite warm. I think we are definitely going into spring. So I went for a walk last night and definitely seeing a lot more flowers, and it's just beautiful. Very nice weather, but we did have a pretty cold winter. So I'm really looking forward to the sun.
Oh, good for you. All right. Thanks, everyone. Thanks for
Thank
joining us,
you.
and have a good evening. Bye-bye.
Bye.